Morning, everyone. My name is Deb Derry. I'm one of the nurses here at Quincy Health Department. Part of our role as nurses here, as most of you know, is education for the community. So now that I keep saying I'm the newer nurse, but I'm going to be here a year now in October. But I call myself the newest, oldest nurse, because age-wise, I am definitely the oldest nurse in there. But we now have a full staff, and we're able to do a lot more education in the community, which is a great thing. Also, too, before we start this, I just want to please make sure if you have any topics that you're interested in that maybe we could research. You know, the three of us are nurses, and we've been nurses, well, I've been a nurse for 32 years now. But, you know, we would love to research and also just have discussions with you about various healthcare topics. So if you do have any topics that you're interested in, either let the ladies know in the office down at the Council on Aging, or just give a knock on that door, slide a note under the door, and let us know, just for future reference, okay? Because we want to make sure we're meeting the needs of the community. So today we are going to be talking about strokes. The signs, the causes, and the treatment. Just to start off, I just want to talk a little bit about the format of the presentation. I'm going to be talking in some general terms, a little bit of specifics. Strokes are something that are very specific to each individual. Although the root causes and the way a stroke actually happens within your body is very common and oftentimes very similar to the stroke person next to you, the way it affects you, the way it affects other patients is usually very different. So I just ask for you to kind of keep that in mind as we're going through this. I know sometimes some people have some very specific questions, and I just wanted to talk today in some general terms about what the signs are, what the causes are, and the treatment. In the middle of this presentation, I have a really good video. It's a YouTube video from Brigham and Women's Stroke Center and the neurology department. So we'll be showing that as well. And it's great because then if you have computers at home and you want to look it up, you're more than welcome to do so. So I'm technologically not there with the younger kids, so please be patient. What is a stroke? The definition of a stroke is it's the sudden death of brain cells in a localized area because of inadequate blood flow. Now, blood carries our oxygen throughout our body. So if the blood flow is interrupted, and especially to parts of the brain, without that blood flow with the nutrients, brain cells will quickly begin to die. I wanted to talk about blood clots a little too. I've got some personal experience with blood clots. Myself, I had pulmonary edema. I had blood clots in my lungs probably about 15, 20 years ago. So I was on a blood clot therapy program at the time. I've also recently had a relative who developed blood clots, and it had to do with her ovarian system. And those blood clots were around her heart and in her arm. So we can develop blood clots anywhere. But there are positive and negatives about blood clots. And I wanted to make sure I talk about the positive because a lot of people just think a blood clot is something that's negative. So a blood clot is a semi-solid mass. It would probably be almost like a jelly-like mass, usually encased in something that may resemble like a netting within your blood system. So that fibrin tissue develops with the platelets, both of which join together. They also can give you a positive outcome. The positive outcome is this. We need blood clots in order to stop and control our bleeding. Examples would be if you had a traumatic event, if you were in an accident, if you cut yourself shaving, and all of a sudden after a while with a little bit of pressure, the bleeding stops. Well, that's because your blood is starting to clot, and that's a good thing. Trauma to the body, the composition of a blood clot works to seal the injured area of any type of a blood vessel. Now, the negative part of a blood clot, so as I wrote, conversely, blood clots block arteries and veins. So they're the stoppers. So just think of like a long tube, and all of a sudden, all the blood's going through, flowing through like a tunnel, and all of a sudden, there's a traffic jam. Something has stopped the blood from flowing. That can be plaque that maybe has built up within your arteries, within your veins, and so that blood starts accumulating and creates a clot. So essentially, stopping blood flow to your targeted areas in your bodies, which would be your extremities and all the vital organs in your body. And when blood flow stops, it means that the oxygen is not getting to the organs in your body. Oxygen's not getting specifically, in this case today when we're talking about stroke, to your brain. So blood carries oxygen. Clots in the veins are also called DVTs. Anyone ever heard of that, right? So DVTs and clots also, not only because of maybe your medical makeup or your dietary makeup, can also be caused by immobility. So make sure you kind of keep that in the back of your mind as well. I often say immobility is probably the cause of so many things that we don't really think about. Someone develops pneumonia and they say, oh, I got such a cold, Have you been up and moving? Have you been able to cough and expectorate? Immobility allows things to pool, fluids to pool in the lungs, which then causes things like pneumonia. Immobility causes blood to sit still and pool in your veins, in your arteries. And without any kind of movement going, it can pool, accumulate, and develop those clots. All right, I'm going to show the video now because I came across this video and I really liked it. It's the head of neurology, one of the heads of neurology from Mass General and Brigham and Women's, and it really talks very clearly about strokes, prevention, causes, and also goes through something that we're going to go through a little bit more in detail, Life Simple 7, okay? You're all so quiet, I love it.
Strokes that happen annually in the United States. That's one every 45 seconds.
Hello, my name is Dr. Natalia Rost. I am Chief of the Stroke Division at Massachusetts General Hospital
I'm Shaheen.
and Professor of Neurology at Harvard Medical School. And this is Understanding Stroke. Stroke is not an accident. Our brains is what makes us human. Our thoughts, words, emotions, the way we connect with each other in the world, it's all in the works of the powerful human brain. Brain is also the organ that's affected by stroke. We often hear stroke being referred to as a brain attack, but also stroke is related to as an accident. And as neurologists, we know that this is very far from the truth. All strokes have underlying causes, and today I will share information with you that will help you understand stroke and how to prevent and overcome it. Stroke results from a sudden disruption of blood flow to the brain. And there are two major types of stroke. Ischemic stroke is the one that results from a blood vessel being occluded or plugged by a piece of a blood clot. Another type of stroke resulting from a rupture or a burst blood vessel in the brain, that type of stroke is called hemorrhagic stroke. Human brain is a very needy organ, and that's why it requires a high blood volume. When the blood flow is disrupted, like for example in a case of a tiny blood clot traveling to the brain vessel and occluding it, brain cells begin to die. This can happen within minutes from the blood flow disruption, and that's why stroke is an emergency. And we want you to contact 911 or any local medical emergency response to get you to the hospital as soon as possible. Patients experiencing any type of stroke, no matter how minor it is, should seek urgent medical evaluation for us to increase the chances that we can prevent the damage, decrease the disability, and worse yet, death. Stroke is just the tip of an iceberg. It's not a disease in itself, it's a manifestation of an underlying problem in the body. More than 3/4 of stroke have a clear underlying cause, which we can directly link to the blood vessel damage in the brain that causes the stroke. Those well-known conditions are called risk factors because they're directly connected to the risk of stroke. The most common risk factors for stroke are conditions that are well-known and highly treatable. These are high blood pressure, diabetes, high cholesterol, smoking, and excessive alcohol use. All of these can be treated very effectively and prevent majority of the strokes that are happening in the United States and around the globe. In a smaller proportion of patients, we are unable to find the underlying cause no matter how hard we look. We refer to those strokes as cryptogenic, which means of unknown source, although in truth, these are most likely related to genetic underlying conditions or environmental exposures that we're not able to identify. In this case, we do everything we can to educate and counsel patients to prevent the strokes in the future and to optimize their medical management. We know now that age is a risk factor for stroke, and that for any individual over age 55, with every decade, stroke risk is increased proportionally. We also know that strokes are more frequent in individuals of African American descent as well as those of Hispanic ethnicity, as an example of a health disparity in the United States. For some individuals, risk of stroke is somewhat elevated because their parents had a stroke, and we refer to that condition as familial, even though stroke is not a genetic disease. But whatever your individual story is though, the one thing to remember is that you are not a victim of stroke. Stroke is a leading cause of disability and death in the United States and worldwide, which is of course of great concern to the medical community and should be concerning to the public. But there is also a reason for optimism. We have a saying, stroke is preventable, treatable, beatable. Thousands of medical professionals around the world work together as a team to make sure that the stroke disability and death are a thing of the past. The fact that we can identify most of the underlying causes of stroke gives me great optimism, because if we can diagnose them, we can effectively treat them and therefore prevent strokes in the future. Despite our best efforts, strokes will happen. And the single best thing that one can do is to educate yourself and your loved ones about stroke, like you're doing right now. Know your risk of stroke, take every measure to prevent it, but know the signs and symptoms of stroke and act fast to maximize the chance of stroke recovery. FAST is the acronym developed by the Department of Public Health that helps raise awareness of stroke symptoms. F is for face, A is for arm, S is for speech, and T is for time. If you see somebody having a face droop or arm weakness or speech difficulties, call 911 or any other emergency services to get you to the hospital fast. One of the most common mistakes people do is they wait for the symptoms of stroke to go away. We have a saying in neurology, time is brain. With every minute passing by, brain cells are dying and causing irreversible damage to the brain. Another common mistake people make is taking an aspirin like they would for a heart attack. In stroke, this is wrong and potentially dangerous because, as we've learned already, not all strokes are created equal. In case you are having a hemorrhagic stroke, not an ischemic one, this could be a dangerous and potentially a deadly mistake. Instead, get yourself into the hospital as soon as possible, where we could do early and very effective diagnostics. One of those diagnostics is a brain scan called a CAT scan or computed tomography. A brain scan is like a powerful X-ray that helps us differentiate between a hemorrhagic or bleeding stroke and ischemic or clotting stroke. Also, if we would add a dye to that diagnostic, we might be even able to see a clot, When you arrive to the hospital early, as we urge you to do, we might be able to administer powerful medications. One of them, a powerful clot buster called TPA, has to be delivered within a very narrow time window, 4.5 hours. That's why we're asking you to get to the hospital as soon as possible, no matter how minor your stroke symptoms are. Another type of therapies we can offer is something that's called thrombectomy. Thrombectomy is a surgical intervention which is similar to cardiac catheterization, except that the catheter is going all the way into the brain vessels to remove the clot directly. This is a special procedure that is done by very highly trained doctors at the stroke centers. That's why sometimes ambulances will take you from your local communities to the nearest stroke center where these procedures can be done and your chances of recovery can be improved. Once your stroke is diagnosed and managed in the very early stages, your doctors will formulate a personalized plan for your prevention, treatment, and recovery. You will also likely require physical, occupational, or speech therapy to help you recover after stroke. Because everybody recovers at a very different rate after stroke, it is very important for you to stay in touch with your primary care doctor and with your neurologist to help you in your recovery. I often get asked about strokes in women and whether they're different than those in men. And my answer is yes and no. No, because stroke is largely dependent on the area of the brain that is being affected either by ischemia or by bleeding. So in that way, whether you experience difficulty speaking or paralysis, men and women experience stroke very similarly. However, women frequently experience stroke in a different way where the symptoms could be milder, they could be accompanied by a headache or a feeling of unwellness. And that's what makes stroke in women different. In addition, women are often stoic, primary caretakers for others. They tend to underestimate the severity of their stroke and underreport them. Even medical professionals underestimate symptoms of stroke in women. This leads to misdiagnosis and worse outcomes after stroke. My message to women is to know stroke symptoms and to be proactive in seeking emergency care they deserve. Take care of yourself to be able to take care of others, and act fast. It's fundamentally unfair to have a stroke when you're young and otherwise known to be healthy. I dread every time when I see a 20 or 30-something-year-old admitted to the hospital overnight with a stroke, because I know that their lives will never be the same. But at the same time, taking care of these individuals is an inspiring and hopeful feat because of the perseverance and a greater recovery that they invariably achieve. Stroke is often seen as a disease of older age, and it is true that most strokes occur in older individuals. However, it's often not when, but why. The same risk factors that we usually see in older individuals, we now see in the 40, 30, and 20-year-olds. Some of the most common risk factors for stroke in young adults are the usual suspects: high blood pressure, diabetes, high cholesterol, and smoking. Some of the others include drug use, infections, including COVID as we learned in 2020, and exposures to the over-the-counter supplements, including so-called health supplements and energy drinks. There are, of course, rare conditions that affect the risk of stroke in younger individuals that they have no control over, but we have to control what we can control. Preventing stroke is easier than you think. Following decades of research, the American Heart and American Stroke Association professionals developed a simple formula called Life Simple 7. This is a set of measures that they propose to prevent heart disease and stroke. Stop smoking, manage blood pressure, eat better, control cholesterol, get active, reduce blood sugar, lose weight. All these measures have scientific underpinning and specific goals. For example, we ask our patients to exercise a minimum of 150 minutes a week. Moderate exercise like walking will do, and it's better if you do it daily. Also, mindfulness could be a measure to getting handle on stress. There are also targets for blood pressure, sugar, and cholesterol. But to make it easier for you, I urge you to talk to your doctor and to understand your risk of stroke. Remember, stroke is preventable, treatable, beatable. You're not a victim, and together we can beat stroke.
Wasn't that a good video? It really, really, it covers so much.
Now you're ready to help
Oh.
people customize and save
No,
$652?
no, we're not saving anything. Liberty Mutual, of course, they have to get in on the commercials, right? All right, let's do this. Okay. And let's go to you. And all right. Okay, so again, I'm not the brightest bulb in technology, so please bear with me on this. So I wanted to go over the Life Simple 7. It all makes sense, doesn't it? And if we could all follow Life Simple 7, we wouldn't be sitting here right now discussing how to prevent strokes. Stopping smoking, I think that's pretty much a given to most people. Going to prevent heart disease, going to prevent lung disease. I'm happy to say that I think even, and you might agree, in social areas, we see less and less of people smoking, which, which is definitely a wonderful thing. Managing your blood pressure. Now, managing your blood pressure, again, as the doctor said in the video, a lot of this, make sure you're consulting your physician to know what a good number is for you. A good number for you may be 110/70. A good number for you may be 132/84. Each person is very different dependent on what we call comorbidities, the other things that are going on with them from a health perspective. Eating better. We all need to eat better. So nutrients are so important to preventing the strokes that we're talking about today, because those are going to be what's working in our body to stop that blood from clotting when we're at risk for it. And cholesterol, controlling cholesterol. So I did this because I knew the question may come up. It's a commonly asked question about LDL versus HDL. You all hear that in the doctor's office, you see it on TV, people talk about it frequently. LDL, I listed out here, sometimes called the bad cholesterol. So when your LDL accumulates, it builds up on the walls of your blood vessels. The buildup is plaque. It's almost like a cement-like fibrous tissues that build up on the inside of the vessels that then start to occlude and make your blood vessels a lot smaller. So less blood is now allowed to go through and less oxygen is allowed to go through. Buildup is called plaque and can cause health problems, heart disease, and eventually stroke. HDL, sometimes called good cholesterol. Now, the good cholesterol is absorbed back into the blood and carries it to the liver, where it is filtered through out to the rest of your body. And higher levels of an HDL can prevent the risk of it. So that filtering of this actually helps because it is a fibrous, almost cement-like tissue that's in there. But if it is filtered through the liver, it can help your body to process and move blood a lot quicker. So the LDL is what's going to be stopping the blood from moving. The HDL is going to be what's going to be helping it. Okay? You have a question?
I'm curious, when you say cholesterol, should we be more concerned with the saturated content of the cholesterol as opposed to the total?
So I would look on your labels, read your labels, and look at the saturated content versus the other. And also look at the milligrams and so forth on any labels that you are eating, any type. Read labels all the time anyway. I'm blown away sometimes when I pick up something that I think is going to be healthy. And we were getting the Lipton green tea, in the bottle. I'm like, oh, I'm drinking green tea now, healthy, healthy, less sugar, whatever. Looked at the bottle, and the amount of sodium in that one bottle was half of what my daily intake of sodium should be. So just make sure you're looking at labels. It is really very, very crucial. And when you go to your physician and you have your bloods done, and if they are checking your cholesterol, if you are prone to it or whatever, ask them for the breakdown and talk to your physician about the breakdown itself.
I have one question, excuse me. I mentioned to my primary care physician before I had my blood work, if they can do, because I read about the small particles and the large particles.
That would be above my pay grade, I think. But go ahead.
Because it says, of course, but she sort of saying that's why we have the breakdown and all that. But it doesn't really tell me, because the small particles are more, of course.
They are.
goes through.
They go through a lot easier. Yeah.
So,
I just would tend to tell you, if your physician is not able to, really give you any direction, stick with the numbers, read your labels, and ask them for the breakdown when you are having the blood. Yeah. Yeah. Sorry. All right. Get active. So getting active, they say, what did they say, 1,500 minutes or something like that, or 150 minutes a week. And when I first heard it, I was like, 150 minutes, holy cow. But when you break it down, if you're walking for a half an hour, 5 days out of the 7 days, that's not too bad. That's not too bad. And even just walking. I put up a couple of things here. Getting active is doing things that you find something you like. Find something you like to do. Zumba, dancing, yoga, just walking, taking a walk, golfing, sports, any of that. I love seeing here when everybody does the Senior Olympics, because it's clearly sports that people loved throughout their life, and they're continuing to do it now. So to just really try to make every effort to do so. As we said, sedentary immobility is going to contribute to so many different health issues. Reducing blood sugar. So again, this is something that's very individual to each person, whether you're insulin diabetic, non-insulin diabetic. If you're not diabetic, make sure you're looking at sugar content, because again, I was thinking less sugar in the green tea, oh, I'm doing better. On the flip side, I'm getting more sodium. So it's a balance, all right? It's a balance. And lose weight. I have no other words other than to try to lose weight, to try, make every effort. And as we know, most times as we're getting older, it gets even more difficult to do so. So the mobility and the eating nutritiously and making sure that you're getting up and making that effort to move is super important. I listed out a couple of common treatments. There are many others of common treatments. One is, which the doctor referred to, TPA. So TPA is a medication, it's a treatment that's done mostly in emergent situations. If someone has had a stroke and they are diagnosed within, like, say, a 3 to 5 hour time frame, they are eligible to receive this, which is a very strong medication that usually will be able to stop and prevent breakup clots and do the job for them. Most of those patients are patients who come into the hospital with an accident, so oftentimes trauma teams are the ones utilizing that. Or somebody maybe is hospitalized for something else, and while they're in the hospital, they may have a stroke, and then the healthcare team is able to implement TPA. The other one is just, I wanted to mention, just general blood thinners, anticoagulants. So different anticoagulants are things like heparin, Coumadin, Lovenox. There's tons of different names for them. Recently, I just had a loved one who, as I said, she had blood clots. We started out on heparin in the hospital through the IV. She went home and then was put on Xarelto, which is pill form. And so she was taking it at home. If you are on blood thinners or you know someone on blood thinners, they are definitely at risk for bleeding. So make sure that they're careful about not falling, not bumping themselves. If they're cutting, if they get a cut, make sure that they're very careful about that, because clearly you're taking medication to thin your blood, you're gonna bleed a lot more than you normally would. And then the next spot after that, she actually had a fall, no bleeding, but then ended up getting Lovenox, which was an injectable that she had to receive daily. So there are many different types of anticoagulants. If you are on any of those, and if you get treated anywhere, make sure that the emergency team knows that you are on an anticoagulant, because they need to know if they go to put an IV in, they want to make sure that they watch the clotting around the insertion of the IV, and if there is excessive bleeding, that would explain why, because you're on the anticoagulant. Yeah.
Baby aspirin considered a blood thinner?
So not necessarily baby aspirin. So as they said, it really, with a stroke, you have to, as she said in the video, you have to watch which type of a stroke you're having. So in an emergency situation, it is best not to give an aspirin to someone that may be having a stroke, because that aspirin will thin the blood. It will thin the blood. But if you're having a hemorrhagic stroke, which is your vessels are bursting and you're bleeding internally, we don't want the blood to get even thinner and thinner and thinner, and then to even bleed even more. The other one is the ischemic, where there's actually a blockage of a vessel by excessive plaque, and that would be the one that they probably would be looking to use aspirin for. After we're implementing a treatment, we're going to go to rehabilitation. So I found these statistics with the American Heart Association and the CDC. 10% of stroke patients are without a severe disability. 10% of stroke patients are so severely affected that they would remain hospitalized until being able to participate in a program. And happily, 80% of stroke patients can return home with appropriate therapy, training, support, and care services. So they talked about the acronym FAST, F-A-S-T. That's something, if you're taking notes, you might want to write down. It's interesting because I keep referring back to this loved one, but she was definitely a potential for a stroke. I thought she was having a stroke one day, and it actually was a blood clot in her arm. She said she couldn't feel her arm, I had come to her house, and she was crying and was in pain. She said, I can't feel my right hand, And I bent down on the floor next to her, and I was like, look at me. And she's like, crying, and she's like, why? I'm in pain. And I'm like, smile. And she's like, I don't want to smile. Like, she was so angry at me. But that's one thing to do. A smile usually is symmetrical on most people's faces. If you see the droop or whatever. Plus, she was slurring a little, and I said, you're slurring. And she said, I just woke up. I haven't had anything to drink yet. So her mouth was dry. But I was trying in my head, as a nurse, you know, just going through, okay, squeeze my hands, smile, let me see if, you know. Come to find out, she had a blood clot in her arm. It was occluding the blood from traveling down to her hand. So she had no feeling in her right hand. So of course, when she said, I have pins and needles and I have no feeling in my right hand, I'm like, stroke, stroke. I knew it was a stroke. It wasn't. It was blood clots. And what they actually did at St. Elizabeth's was they did vascular surgery. They went in, as the physician was saying, they went in with a catheter, and they actually have a little bit of a vacuum. I met with the surgeon afterwards, and he explained, and he said, I was able to get in, get to the clot. I inserted the vacuum that is like a wire, and they pulled the clot out. It went through the vacuum, and he said within probably seconds, she had pulses back in her hand. I was like, you're a miracle worker, you know? Just amazing, amazing. But just so you know, like, that's a good example of something that you might say, oh, she's having a stroke, she's having a stroke. But it could be something else, and it could be blood clots. So, good example, I thought. Okay, takeaways from today. We're gonna try to follow the Life's Simple 7. I don't know if they're simple, but it's basic. To really just try to take care of yourself. Eat right, make sure you're seeing a physician, and you know, also to, you know, I kind of jumped down to always call 911. If there's any question that you might be having a stroke, or someone else that you're with might be having a stroke, call 911 as soon as possible, because you may get that window where you're able to treat them very quickly and stop a full stroke. Understand what FAST stands for. Always follow your gut on something. Many years ago, I woke up and I was 50, and I put my feet on the floor. I remember sitting up in bed and I was like, wow, oh, I must have slept on my elbow. I must have slept on my arm or whatever. And I put my feet on the floor and I couldn't feel the floor. Flip my feet back up on the bed. I'm like massaging the bottoms of my feet and tried it again. And I almost felt like I had a pad underneath both of my feet. Wasn't sure what it was. Thought could be a stroke. As we said today, as the doctors said today in the program, family history, although they don't put 100% into that hereditary. Ourselves, my DNA is my mom's DNA, my dad's DNA, and so forth and so on. I was thinking it was a stroke. My mother had a stroke when she was young, and I immediately called my husband, which is very unlike me, because I am one of those, it'll just go away, you know? I'll get up, I'll walk around, I'll get the feeling back in my feet. I called my husband and I said, something's not right, have to go to the hospital. Long story short, I was diagnosed with an autoimmune disorder called Guillain-Barré syndrome. And it affects you. The reasons why you may have a spike in this is it could be because your blood pressure has had an extremely high spike. I was not on any medication prior to this. An extremely high spike in blood pressure, increased stress levels. Also, a reason why could have been Guillain-Barré syndrome is one of those questions they ask you when you get the flu vaccine. Do you have Guillain-Barré syndrome because of the virus and so forth? I had the flu vaccine probably a month or 2 months before, which I was, of course, in my head diagnosing myself all over the place. And, but I didn't wait. And by the time I got to first Connie, then they sent me to Beth Israel in Boston to be seen by the head of neurology there. And that's where they diagnosed me with this. And I had to receive an IV therapy. It's a specific protocol for this. It's 5 days in a row for 24 hours infusions. They said to me, if you had waited, if you didn't trust your gut on following up on this, oftentimes people with Guillain-Barré syndrome, it affects their central respiratory system, and they end up most times on ventilator support, so they can't breathe. And they said, you trusted your gut, and I'll never forget this. The doctor said you trusted your gut and you knew something was not right. So moving forward, you know, with your family and the people and the patients you come in contact with, make sure you tell them, trust their gut, okay?
That was from the flu vaccine?
There's no way to tell. These are the reasons why I could have had it. How many people are diagnosed with different types of medical conditions? And it could have been because of this, it could have been environmental, it could have been hereditary, it could have been...
So did it go away?
I will always have that diagnosis. Now, they advise against me getting the flu vaccine because of it. Just to be on the safe side. Just to be on the safe side. But I got the COVID vaccines because the COVID vaccine is very different from the flu vaccine as well. So, but just an example of following your gut. If you feel, if something's not right, make sure you're calling 911. Make sure you're telling someone that you need to see a physician. And remember, any of us are susceptible of having a stroke. As we talked about, people who are 55 and older are much more predominant for strokes. Women are affected very differently than men on some levels. Young adults can have strokes. I have seen a child who has had a stroke. So, yeah. And mainly, I actually took care of a baby who had had a stroke at 6 months. And it was because she was a twin, and during delivery, she was separated, the placenta separated, so she was deprived of oxygen and blood flow to her brain. So they were monitoring her brain, and probably a month later, they showed on her CAT scan, which I was also very happy they talked about what a CAT scan is and an MRI here. It showed that she was having some type of a small stroke, and so they medicated.
If you've ever had a concussion, what does that do for your liability, you know, for a stroke? Does that make you more susceptible?
I would say any type of trauma to the head, you would want to make sure that you kind of staying on top of and making sure that if you have any type of symptoms, you know, even things like double vision or anything related here, stay on top of it a lot more than without that. Any type of head trauma, you want to make sure. Yeah.
Would there be a list somewhere that would tell you which medicine or shots you should not take according to what you might have? Like you said, not to take the flu because of what your diagnosis.
I don't know that there are any, I have not seen any kind of publications like that. But if there are questions about certain medication, definitely ask your doctor or even ask your pharmacist. You know, ask the pharmacist about it. They should be giving you, you know, those, you know, you go to Walgreens, you go to CVS, and they staple that big paper that I usually just take and shred. Probably in that paper, it probably says, if you are taking this medication, do not do this, do not do that. So let's make sure that we're following the directions on the medications and making sure that we're in touch with our primary care doctors. Okay?
You talked about the medical team that does the bus, the clot busting. What hospitals around here have that kind of team? Because I know a friend of mine did have a stroke last year, and she went to the hospital and they blasted it.
Yep. Yep. So all of the major hospitals in Boston, I would tell you that, I can just tell you, there is no, I can vouch for, I can vouch for Beth Israel, Boston, the one downtown, just because I was on the neuro floor. So I was up there with the stroke patients and everyone else, and they were absolutely phenomenal, an incredible neurology. She's from Mass General Brigham. We're so fortunate to live where we live and to have the resources that we have. I know everybody's got their, oh, I would never go to Tufts because this happened. I would never go here because that. We all have our likes and dislikes. But I'll tell you, we are extremely fortunate to have all of these larger hospital medical centers around. Even, you know, God bless South Shore down there. I know people are frustrated with them because of wait times and all of that, but they are the only big medical center that we really have, like on that South Shore area, and they're trying their best to try to get people taken care of. So.
Do you think Quincy will ever get a hospital back?
Oh God, I don't know.
That was the most stupid thing for Quincy not to fight.
I know. It's very
for
sad.
that hospital.
It was very sad.
They let us down, in my opinion.
It was very sad to see that hospital close. It was. But we're surrounded by other very good clinicians in the city, in the state. And please make sure, if you have any questions about any of this information or even your own care, call your primary care doctor. Don't wait. Trust that gut, okay?
Do you have any handouts?
I don't, but if you'd like a copy of the presentation, I can print some out and I'll put them out probably by tomorrow. I'll leave them out on the health desk out here, okay? Yeah, sure, absolutely. All right, have a good day, everybody. Stay healthy. Thank you.